Hi, my name is Kelly. I am one of the registered dietitians at the Bariatric Clinic at Humber River Hospital. It's my pleasure to guide you through this online information session on bariatric surgery program, Part 4, Making Bariatric Lifestyle Changes. In this module, you will learn about the lifelong diet and lifestyle practices about bariatric surgery. We encourage you to start making some of these lifestyle changes before surgery to help set you up for success in the long term. If you haven't done so already, please download a copy of the Bariatric Resource Book from the Humber River Hospital website and reference it as you go through this session. As we have discussed in previous modules, following the bariatric lifestyle changes can reduce the risk of common nutritional problems, increase food tolerance, maximize digestion, and optimize health, weight loss, and long-term success. As such, we encourage you to start making these lifestyle changes now. You can use the checklist on page 31 of the Bariatric Resource Book to help you create a plan and track your progress. Also, please be prepared to discuss the lifestyle changes you've made with the bariatric team to demonstrate your commitment to having bariatric surgery. Let's review these lifestyle and dietary changes now. After surgery, it's important to establish and follow a meal routine to include 3 meals plus 1 to 2 snacks per day. It's important to eat even if you don't have an appetite because skipping meals can lead to malnutrition and cause weight gain in the long term. Aim to have your first meal within 2 hours of waking and space your meals no longer than 4 to 6 hours apart. Include protein-rich snacks in between meals as needed. You can also refer to page 15 of the Bariatric Resource Book for examples of meal routines. Please make sure you include lean protein foods at each meal and snack. You must aim for 70 to 100 grams of protein per day to maintain your lean muscle mass and will need to include 1 to 2 protein shakes per day for the first 3 months after surgery. You can also refer to page 84 of the resource book for a list of protein-rich food sources. Eating balanced meals and snacks ensure that you can consume a variety of nutrients. Please review the balanced plate model, which provides protein, carbohydrates, and vegetables at each meal. You can refer to page 16 of the resource book for more information on the balanced plate. Here's how a balanced plate looks like. The portions listed here are specific to after bariatric surgery. You can also follow this balanced plate to practice healthy eating before your surgery. Your portion before surgery may be larger, and try to aim for half a plate of vegetables, a quarter plate of starch and grain, and a quarter plate of lean protein. Here are some examples of foods from each food group to help you build a balanced plate. Foods like pork, beef, eggs, bread, rice, and pasta may not be well tolerated after surgery. You can also refer to pages 22 to 23 for more examples. Here are more examples of balanced meals and snacks. You can also find sample menu plans from page 109 to 117 of the Bariatric Resource Book. Let's continue with other bariatric lifestyle changes. You can start practicing mindful eating techniques now. Take your time with meals, chew your food well, separate food and fluids by 30 minutes, and eat smaller portions at mealtimes. This can help prevent vomiting, nausea, blockage of food, and dumping syndrome. It also improves food tolerance too. We encourage you to start researching vitamin and mineral supplements now. You will need to take a multivitamin plus minerals, calcium, vitamin D, and vitamin B12, which are all required lifelong. Supplements must be chewable or liquid for the first 3 months after surgery. Additional supplements may be required depending on the results of your blood tests. Maintain your hydration by sipping on fluids and aim to drink 1.5 to 2 liters of water per day. Water should be your drink of choice, and you may choose non-caloric beverages too. Avoid carbonated drinks and drinking from a straw, as they may cause gas and bloating. They may also stretch the stomach pouch, which can lead to increased food portions and intake over time and potential weight regain. After bariatric surgery, you also want to avoid foods with dry and tough textures, as they are more difficult to digest. Instead, choose moist cooking methods like steaming, boiling, or braising, and avoid preparation methods that dry up the food. This can prevent pain and the feeling of food being stuck. Avoid foods that are high in fat, sugar, and sodium. Dumping syndrome can occur if you consume high-fat, high-sugar foods. So make sure you read food labels and choose foods that have less than 10 grams of sugar and less than 5% daily value of fat per serving. Pages 17 to 20 of the resource book will guide you through how to read a nutrition facts table. Make sure you look at the portion size and choose foods that are low in fat, sugars, and sodium. Choose foods that are high in vitamins, minerals, protein, and fiber more often. Avoid caffeine for 3 months after surgery, as it can irritate the stomach pouch and increase the risk of developing a stomach ulcer. After 3 months, limit caffeinated beverages to 1 to 2 cups per day. You also need to avoid alcohol for the first year after surgery. Drinking alcohol can increase the risk of dumping syndrome, weight regain, and developing a stomach ulcer. It also increases the risk of intoxication and impairment since it is absorbed more quickly after surgery. As such, we encourage you to start reducing caffeine and alcohol intake now. To help you keep the weight off long term, you may want to plan your meals in advance. Consider batch cooking, pre-portioning, and freezing foods. You can also wash and chop fruits and vegetables ahead of time. Please refer to pages 21 to 25 of the Bariatric resource book for more information on meal planning. Try to engage in 30 minutes of physical activities daily. This not only helps with keeping the weight off, but also provides many medical and health benefits in addition to improving your energy levels. And lastly, if you notice yourself engaging in emotional or mindless eating, try to avoid distractions during mealtimes. This allows you to know what and how much is on your plate and lets you stop eating when you are full. You can also refer to the resource book, pages 72 to 75, to learn how to identify eating triggers and implement healthy coping strategies. If you find yourself engaged in emotional or mindless eating, consider trying one of these things to do instead. These non-food related strategies may be able to distract you from giving into emotional cravings and help you to realize you may not actually be hungry. The Bariatric team has developed additional video resources to assist you in making lifestyle changes. Please check out these videos for more details. They can also be found on our surgery website at www.hrh.ca/programs/surgery. Weight regain after surgery is normal and expected. Weight stabilizes about 12 to 18 months after surgery, and regaining 5 to 10% of the weight you lost can be expected. Following the bariatric dietary and lifestyle recommendations can help minimize weight regain and maintain weight loss. You can pause the video and read the list on the screen, which describes common reasons contributing to weight regain in bariatric patients after surgery. If you notice your weight trending upwards after surgery, review the bariatric recommendations and speak to your bariatric team for support. Here are some final thoughts before we wrap up this session. Bariatric surgery is not a diet. There are serious complications and risks associated with it. In order to maintain long-term weight loss, a patient must commit to the lifestyle and dietary recommendations and be able to manage stress and time. After reviewing the resource book and online videos, think about if surgery is the right choice for you. Can you do this for life? What are your barriers to success? Can you afford the cost of bariatric surgery? Make sure that you are making an informed decision for yourself and understand what impact bariatric surgery has on your quality of life. Use this knowledge checklist to make sure you understand the bariatric lifestyle changes. Make sure you understand the nutrients that you have to prioritize and eating pattern that you have to follow after surgery. Make sure that you review the eating techniques after surgery and what some of the lifestyle and dietary changes you can start making now. Also, use this opportunity to reflect on the potential challenges or barriers that you may encounter after bariatric surgery. You have now completed the 4th module of the information session. Please proceed to Part 5, Preparing for Your Appointments.